The stand-up lifter transfer. A stand-up lifter is required for the client that still has the ability to weight bear, but not the ability to hold this position for too long. When using a stand-up lifter, you want to ensure that the client is seated with their feet on the ground. You then need to place the sling. The sling goes around their waist and under their arms. You ask the client to lift their arms. And of course, you've already explained this procedure to the client, so they're aware of exactly what's going on. You okay? You fasten the Velcro strap, pull the sling around, and drop their arms. Once they're ready, you just let them know that you're going to bring the lifter into position. Before you get there, you widen the legs on the lifter to give you a nice wide, stable base. You bring the lifter closer. Before you get there, you ask the client to lift their legs. If they can, they do. If not, they may require assistance from your partner. You bring the lifter in close enough for their knees to be securely up against the knee pads. Once here, you need to fasten the sling. Before you do, you want to make sure that the client is able to sit back into the sling. If it's too tight and you start the lifter, the weight will pull them forward, the sling will rise and drag them off the bed and possibly into the lifter. So for this client, we're going to use the back loops and put the green loop on. You may need to get them to come forward to secure the loops and then ask them to lean back. Okay? Yes. Once they're in the lifter, get them to securely hold on to the handles and you're ready to go. Inform the client that you're about to take up the load. You ready? Okay. And just lean gently back into the sling. It'll take up your load. When the lifter starts to pick up their weight, you ask them to gently push down with their legs. Just gently push down. Okay? Yes. Once they're off the bed, you then need to move them away. You get yourself set up in your lunge position with the weight at the front. Again, trying to make sure that you have your wrist as close to neutral as possible. You lock in your shoulders and your elbows, and you gently take the weight with the front leg, pushing backwards. This gives you a nice, smooth transition. When you go to change direction, keep your core on and your core unit in a nice solid position. About to go forward, you start with the weight at the back leg. Make sure you've got your unit on and push forward. You line the client up with the chair and let them know that we're almost there. You then let the client know we're about to lower, talking to them all the way. You're almost there. The chair is just underneath your bottom. There you go. You don't put the brakes on the lifter as it may need to move backwards a little bit and will find its own centre of gravity. You ask the client to move forward so that you can release the sling and get them to sit back. You then ask them to lift their feet. Again, they may require assistance. Just lift your feet for me, please. And you take the equipment out of the way to remove any trip hazards. You then remove the belly strap, ask the client to lean forward and remove the sling. Okay. Make sure they're comfortable and the procedure is completed.